Let's talk about all this with Professor Gavin Yamey in Durham, North Carolina. He's the Associate Director for Policy at Duke University's Global Health Institute. He also helped to design the COVAX body. Professor, thanks so much for joining us. How do you vaccinate the world?
Well, so we have an immediate crisis, which is that if you look at all the doses that are being distributed, just 0.3% have gone to low-income nations, which have 9% of the world's population. That's because rich nations have hoarded doses. They've cleared the shelves. They entered into direct agreements with vaccine manufacturers to hoard the doses, and many of them are blocking low and middle income countries from making their own doses. So they're hoarding and blocking. The immediate, urgent action that has to be taken is for rich nations to start sharing doses. We've just heard that the Serum Institute for India absolutely understandably is going to make sure that its vaccine supply goes to India, which is in crisis. That means the rich nations have to step up and start donating hundreds of millions of doses to COVAX now to get shots in arms today.
You used the word hoarding, but some of those governments of industrialized countries would say they were simply trying to book enough vaccines when they didn't know which vaccines would work and which didn't.
That's an understandable viewpoint, but let's be clear what COVAX was all about and what Dr. Tedros, the Director General of the WHO, called for. He said all nations should vaccinate health workers and high-risk people first, and then you can think about expanding to the general population. He asked rich nations to pause once they had vaccinated high-risk people and health workers, pause and start donating to COVAX at the same time as they were vaccinating their general population. That never happened.
No one did that.
Never paused.
But you can understand a government is put in power, is elected to protect its own people. Protect its people first and then help others. That is an understandable thing to do.
Well, let me say this. If you look at what's happening in India, how can you not feel anything other than abject horror at the injustice and the inequity? You've seen the scenes, I've seen the scenes. We should be acting out of a sense of international solidarity. And what's more, it's terrible for rich nations when we let this virus go unchecked worldwide. First, of course, an outbreak anywhere can become an outbreak everywhere very quickly. You've just been talking about the B.1.617.2 variant from India, now in the UK. Britain cannot hermetically seal its borders from other countries, so it comes back to bite us in the end. What's more, economically, it is terrible to let infections spread around the world. One study out of Turkey estimated that if rich nations largely vaccinate their own communities, their own populations by the end of summer, and they leave low and middle income countries behind, the loss to the global economic loss will be $9 trillion, and half of that will be borne by rich nations. We should act, yes, out of solidarity and justice, but also enlightened self-interest.
Professor Gavin Yamey, thank you so much.
Thanks.